Bismillahirrahmanirrahim. Assalamu alaikum. Today I will talk about child protection, or also called safeguarding or child abuse. The safety of children everyone's responsibility. Do you know the first recognized case of child abuse was in 1874 in United States, and the name of child was Mary Ann Wilson. The tragic deaths. The tragic deaths like Jasmine Beckford's death in 1984 shocked the nation and led to the Children Act of 1989. This child was starved and battered to death by a stepfather. And the other child was Victoria Climby's death in 2000, which was resulted in Children Act 2004. She was also tortured and murdered by her great aunt in 2000. The Zainab Ansari death in 2018, she was kidnapped and murdered by the neighbor, and after that the Pakistan's first national child abuse law, which was Response and Recovery Act 2019. But this is not the end. The other child like Peter Conley, baby P, was 17-month-old child. Throughout his life, he was suffered with physical abuse by the caregiver, and at death he had 50 injuries, and he had 35 contacts with healthcare professionals. So it was they could not recognize what is going on with the child. The last was I will tell you about Daniel Palka. These are high-profile cases, and after that they made many changes in the acts and the laws. The Daniel Palka was murdered in 2012 by the caregivers, and this child also visited a pediatric doctor 3 weeks before his death, and they could not recognize what is going on. Actually, they know that this child is going to be abused by a parent like the mother, but they were unable to separate the child from the mother because they don't know what will happen next. Well, this child was murdered by the head injury at lost, and this child had multiple injuries, and even teacher has noticed the child was starved and physical abused, so it was died in 2012. And after that they made also many changes, and they make everyone responsible in children's safety. Why recognition and response is important? Because children may die from abuse, which is less well recognized, or the long-term sequelae in adulthood. So what could be the long-term health problems in a child who has been abused during their early years of their life? Like poor physical health, medically unexplained symptoms, and increase in mental health problems like depression and suicide. Because children are usually going to be abused by their near ones, like their parents, relatives, neighbors. It's very rare that an unknown person is abusing the child, or in sometimes teachers. So the early years are very important, like first 2 years of life, and if there is a severe maltreatment, this can lead to overall reduction in the brain volume. So for example, if child is having maltreated early years, this child might have a lower educational achievements, difficulty parenting, and thereby continue the abusive cycle in the generations. Because if parent is having difficulty in understanding, their volume is low, brain volume has been low because of the abuse, so this cycle is repeated in their children, in the generation that will go, and it has a big impact on the community. So that's why it is very important to protect your community, to protect this cycle to be not to be repeat, and you have to recognize that this child is going to abuse, and how to address this child, how to recognize what injury you should report, and definitely it's very sensitive issue that you cannot separate the child from the parent. It is very sensitive and very difficult decision. So after if the child is having a fatal problem, for example child is having a risk of death, definitely you have to separate, you have to take a decision. But it is not like in the first visit you know that this child will be having a risk of death, so you have to recognize. How can you say? So let us discuss about the types and categories of child abuse. Categories of child abuse. There are four broad categories like physical abuse, emotional abuse, neglect, or sexual abuse. Physical abuse, which is non-accidental injury, NAI, and it is very rare that you will find isolated or one abuse, because usually it is in the combination. Like if there is a physical abuse or non-accidental injury, it could be emotional abuse or neglect or sexual abuse, or if there is a sexual abuse, it could be a neglect or emotional abuse. So these can be very rare. It can be one abuse, but it could be with the combination. So what is non-accidental injury? Physical abuse or non-accidental injury. Definition, recognition and assessment, immediate action, history, examination and investigations. So physical abuse, non-accidental injury, how to recognize. Non-accidental injury, usually physical abuse may involve hitting, shaking, throwing, poisoning, burning or scalding, drowning, suffocating or otherwise cause physical harm to a child, sometimes fabricated illness by the parents. So any child who is having suspicion of non-accidental injury should be examined by the senior pediatrician, or consultant should be involved, which could be supervised by the consultant or senior pediatrician. So how to recognize and assess a child who is having a non-accidental injury? Any child who is medical attention, for example, history is not matching with the injury, for example, delay in seeking medical attention, and mother is saying my baby is crying for 24 hours, and you find the baby has a humerus fracture. Definitely where was she in 20 hours? It's a delayed medical attention or seeking medical advice. And also there are numerous explanations for the injury, or sometimes they are shopping around for the medical help. Sometimes they goes to the GP, A&E or different hospitals. So and baby is having a problem of failure to thrive or neglect, or baby already at the child protection plan. So these are the things you should consider whenever you are seeing any child who is having a suspicion of non-accidental injury. What could be your immediate action? Always discuss referrals with on-call consultant for child protection duties, because if there is a severe maltreatment or severe physical abuse, those children are usually referred by the social care worker or police. So if in this case you have to discuss with the on-call consultant of child protection duties. But if it is not the case, definitely you will examine the child. So if there is a life-threatening situation and child needs an urgent treatment, start necessary emergency treatment. So here is the two categories. The child, you have to examine the child. You should recognize the child is on the life-threatening situation, or if child need an urgent treatment, definitely you will go for the treatment. And you, if parents are not giving the consent for the treatment, you will take a court order consent. But if child is not in the life-threatening situation and it doesn't need an urgent treatment, you will seek a parental consent. If they refuse, then we'll go for the social care worker. Keep any social care worker or police officer involved in this case if there is a severe problem, severe injury. Always consider risk of a sibling, because if one child is abused, definitely at home if there are other siblings are there, they are at high risk of abuse. So you should involve the social care worker in this regard. What about the history? What will you ask in the history and the examination? And in history findings, you have to record all the findings and any full family history and persons who are present at the interview, and source of information, including the child. Definitely you ask the history from the child, persons who has given you a consent, and date and time. So these are the things you should ask in the history. But if, for example, if child is old enough, or for example you want to ask something from the child and child is afraid to tell you something in front of their parent because they are abused by the parent, and child wants you to talk to you separate, alone, without parent, so you have to take the consent from the parent. So in this case, if parents are not giving you consent, no, I will not allow you to examine or take history from a child without me, definitely you will not go without consent, and you will ask the history in front of the caregiver or the parents. So in the examination, you should include the state of a child cleanliness, and also you should accurate description of all injuries, and also if baby is infant, small baby, you will get an ophthalmological examination, like you will check the fundus for second baby syndrome. It could be the retinal hemorrhage if baby is less than 2 years or less than 1 year. Any birthmark or scars are there. Full systemic examination. You should plot height, weight, head circumference. You should check this emotional state of the child during your examination. You check the school progress, if child is old enough for school going. You check the relationship of our behavior during your examination, relationship of the parent and the child. So during your examination, you should check what is the relationship in between parent and the child. And then you will go for the investigations, but investigations always advice from the consultant, because you have to rule out the bleeding disorders. We cannot say all cases who are having child abuse, we cannot say it is a child abuse or physical abuse or non-accidental injury. Sometimes there are some bleeding disorders, but they will present and you will see the child, you will definitely, whenever you will examine, you will think about the non-accidental injury, but actually it is not. And I will show you the picture, so you should recognize what is going on with these children. So these are the two different child. One is on your left, the child is having a bruise on the right eye. So what do you think? Whenever you see this child, what do you think? Definitely you will think about the non-accidental injury, highly suspicious of non-accidental injury. So, but it is not. Actually, this girl is having a large bruise, which is suspicious of non-accidental injury, and the history was it was minor bump and child fell down. But this, after all history and examination and investigation, they found this child is having ITP, immune thrombocytopenic purpura. So because of this is the bleeding disorder. After investigation, they came to know it was not the child abuse. Another baby, which is a 3-year-old baby, who is having bruise marks on the back, and there are some marks on her arm, upper arm. Usually they was thinking about the fork marks, and these were the bruises. They asked the history from the child. The child told that my mother is did this in the kitchen. But after a thorough examination and the history, they found these were the Mongolian spot of the birthmark, and this was the BCG scars given in their home country back when she was very small. So we cannot suspect every child is having a child. We cannot say that every child is having non-accidental injury. That's why I'm saying it's a very sensitive issue, because if it is a real child abuse, you have to separate the child from the parent. So that's why all history, examination, and investigations are important. So you have to look from each and every aspect. The next is emotional abuse. What is emotional abuse? Sometimes emotional abuse is very difficult to recognize. And in emotional abuse, you will find the harassment, disparagement, criticism, threat, and also sometimes it is associated with sexual abuse, neglect, or physical abuse. So how they may present, and in this case it is, if there is emotional abuse, it have a long-term sequelae. For example, if long-term consequences upon social, emotional, and cognitive development. And also this could be very these children could be harmful for the community if they are having an emotional abuse. So usually they're present and with the history of unhappiness, disturb, poor concentration, difficulties in school, and also they have the poor social interactions, unable to play with their peers, and also they have very problem with the attachment with with their other children and the parents, and they are over friendly. Definitely whenever any child who is having emotional abuse, they will see the stranger, they will run toward the stranger to seek attention from the stranger. But the child who is having not emotional abuse, they rarely goes to the strangers. And assessment is very complex and it requires multidisciplinary approach, because it is very difficult to assess these children who is having emotional abuse. May need out mental health difficulties, and if there is any concern, you have to refer this child to the CAMS, which is Child and Adolescent Mental Health Services. So emotional abuse have long-term sequelae, and if you will address emotional abuse at the appropriate time, so you can prevent this child to going to be in problem during their adulthood with their attention and with their behavior, with their education problems. So emotional abuse is also itself important to recognize. Then other is neglect, which may not be intentional. Sometimes parental mental health problem is there. So definitely if there is a problem, mental health problem in the caregiver of the parents, those children definitely will be neglected. Now, how to recognize, which is persistent failure to meet a child's physical and psychological needs. So this is the definition of the neglect: lack of physical needs and failure to thrive. And definitely you will find their nails, which are child are dirty with dirty clothes, and nails are big, and there are no haircut, and you will see the appearance and you will recognize that this child is neglected. So these child also are having a developmental delay, and the presentation usually you will note that clothing, hair, skin, growth. You should plot height, weight, and serial measurements of the growth, head circumference, and also you will see the non-attendance. For example, you are giving an appointment to the child. They did not, parents has not come to the appointment. So these children also neglected by their caregivers. Physical signs could be evidence of other forms of abuse, could be problem in the development, and they might have gross motor skills problem, fine motor problem, vision, hearing, language, behavior delay, and also their problem with the playing with their peers. So these children also, if you find any sign and symptoms of neglect, so these are the neglected, called the neglect. The last category is sexual abuse. So what is sexual abuse and how to recognize the child who is having a sexual abuse? If a child parents in a medical setting they are concerned about sexual abuse, you should call a consultant or child protection immediately. And also if there is any bleeding, child protection agencies may need to involve before medical assessment. So this is very also very sensitive issue of sexual abuse. Sexual abuse, how to recognize, what's the definition, like forcing or enticing child, young person participate in sexual activities, whether or not child is aware of what is happening. So which may involve physical contact, penetrative like rape or beggary, non-penetrative acts, like non-contact activities involving children in looking at or production of pornographic material, watching sexual activities, encouraging them to behave in sexually inappropriate ways. So these are the this is the definition of sexual abuse. How these children may present. Sometimes information given by a child, or they might have a trauma or infection which are bruises, bleeding or discharge from any orifice, symptoms resulting emotional effects, behavioral changes, injuries, braces, self-harming, eating disorder or psychosomatic symptoms, because it is very difficult that child will tell himself or herself that what is going on. So children are getting a problem in their behavior whenever there is something wrong with them. So if they have a behavioral issues, you can also think about it could be a sexual abuse. And also they might have an inappropriate knowledge of the sexual or behavioral inappropriate to the age, and underage pregnancies in the girl, and sexually transmitted infections. Usually referrals, these child referred from the local authority of social care, children's social care, or the police to your department. And history and examination, immediate action is you should have a very careful history, take a careful history and examination. How to prepare for the history? They have some centers like sexual assault referral center, and examination should be in the sexual assault referral centers. And also they have examination purpose of medical examination, detect any traumatic or infective condition, and evaluate nature of any abuse and forensic evidence, resource, reassure the child and start process of recovery. Reassurance is very important in this case. The child, if parents are not involved, also the parents. So you have to reassure, because it has also long-term impact on the child. If there is a penetration injury or penetration is there and passage of bodily fluids are suspected, and you should consider sexually transmitted diseases and pregnancy. You should do the pregnancy test. If assault within 72 hours, you should offer a contraception, ideally less than 12 hours. So if any girl who is having sexually assaulted and sexually abused, there is a penetrating injury, definitely you will go for the pregnancy test. And also you should offer post-coital contraception, ideally less than 12 hours, which is usually levonorgestrone 1.5 milligram state dose. And you should contact the genitourinary medicine department. Post-exposure prophylaxis also important, started within 1 hour of assault if indicated, like example HIV, hepatitis B, post-exposure prophylaxis. And there might be a anogenital warts, because it's not necessary you have received the child the first time. It could be recurrent sexually assaulted. So midstream urine sample for to rule out the UTI, forensic test, and also you have photo and video recordings obtained from by the colposcope and stored in accordance with local policy. Always follow your local child safeguarding policy and procedure. So local policy, we cannot bypass the local policy. So all children need to be kept safe, and it is like the social worker can obtain emergency protection order from the court according to section 44 Children Act 1989. Children's safety is the first, and communication with the staff, nursing staff situation can be supervised, and only a consultant may allow child to go home in a patient who is sexually assaulted. Communication is vital. You should communicate or report this case to the GP of that child, and also social care and the police. And also you should send the copy of feedback to every department, to the A&E, at least they should know. and child protection conference would be there in this regard. So this is about sexual abuse, and this is very sensitive and very important things you should have to reassure. Its psychological involvement would be there because it has a long term, so it could long-term psychological problems. So this was little bit about the child protection or safeguarding or child abuse. So everyone's responsibility of to protect the children, because it is not the issue of one child, it's the issue of a community. If you will protect a child from child abuse, definitely you are protecting your community to be healthy and safe and not to be going into the psychological issues. And if someone has good physical and mental health, definitely they will achieve a good education and they will have a good parenting in future. So it's everyone's responsibility. I hope this will help you, and whatever you can do for the children you have to do in your circumstances, because I know many countries they don't have reporting, they don't have the appropriate authorities or laws so that they follow. Whatever we can do for the children's health and for the children's health and their mental health, whatever we can do, reassurance or psychological supports, wherever you are, whatever you can do for the children health and their psychological issues and their abuse, you should have to do. So it's not like if the government is not, authorities are not involved, so that we will keep quiet. Definitely we have to address these issues, and because of the children health. So early year child protection is important for their mental health and educational health. Thank you very much. Assalamu alaikum.